very brief in support to be multi-branch issues. So we have an agenda. We'll start on our left with this young man here.
Good afternoon, Mr. Chairman and members of the committee. My name is Ian Dunmore. James David Dunmore was my son. In my lifetime, there have been a lot of things that didn't work out the way I hoped. But being a father was the one thing I was holding out for. It meant something more. And when James was born December 18, 2011, 7 pounds 11 ounces after less than an hour of labor, that was it. He wasn't bad. But it was the most amazing little boy I'd ever seen. The nurses remarked about how quiet he was when they gave him his first bath. The way he put his fist in his mouth and shake his head when he was hungry. The funny little yell he let out from time to time. We even had the same ears. When you watch your child come into the world, you love you to feel this instinct. Absolutely. But it was meeting James, getting to know him in the first months that made us really like him more than we ever thought we could. The night of March night, 2012, I was awake with James. He hadn't been feeling well. A fever or a cough is what we thought at the time. It was neither. James was tired, sweaty, and not breathing correctly as a result of a critical congenital heart defect called hypoplastic left heart syndrome, or HLHS. In HLHS, the left side of the heart is not fully developed. Without a series of surgeries at the time of birth, the condition is fatal, causing the heart to stop functioning, to cease pumping blood within just hours, days, or weeks after birth. That night, I held James and told him everything would be all right, that I'd never let anything bad happen to him. The next morning, we rushed him to urgent care, only to pull to the side of the road and call 911. After that, I'm standing over him performing CPR. Ambulances, police cars, an operating table, a room full of doctors, tubes, needles, and that was it. All things considered, I wish I didn't know Sharon well. The reason I do is something no parent should ever have in common with another parent. But I'm here today for Sharon, for her son Ryan, who lost his life to HLHS much the same way James did. And I'm here because of the bill before you now. Our infant children are dying. And they are dying for absolutely no reason. CCHDs occur in 1 of every 100 newborns. They are the most common birth defect. And they claim more lives than all forms of childhood cancer combined. And we simply accept that this happens. We have a chance. No. Pulse oxygen testing is simple, inexpensive, already mandatory in many other states, and it saves lives. It can mean the difference between a child living a long, happy life and having to watch as that child stops breathing on the ER table, or what I did. Making pulse oxygen required newborn tests in New Mexico is saying we want our children to live. Thank you for hearing my remarks and for your considerations.
Thank you. Anyone else? Yes.
Good morning, Mr. Chair, members of the committee. I'm Lance Chilton. I'm an Albuquerque and Santa Fe pediatrician, and I have been for the last 39 years. And I'm speaking on behalf of the New Mexico Pediatric Society, which shares the grief of these families and supports this bill. I'd like to read from my remarks because like the families, will have difficulty not choking up when I talk about children who die. Fortunately, it doesn't happen often in my practice. We as pediatricians and I as a person are devastated by the loss of any child, especially when it's possible that the child might have been saved. For this reason, we in our parent organization, the American Academy of Pediatrics, have worked hard to develop and support newborn screening programs for such important disorders as phenylketonuria, hypothyroidism, and hearing disorders. It is for this reason that the American Academy of Pediatrics issued a policy statement last year supporting the addition of screening for critical congenital heart disease by measuring the concentration of oxygen in the blood of newborns. The New Mexico Pediatric Society would like to work with the sponsors of this bill, with Representative Espinosa, and parents throughout New Mexico, to develop a system to accurately determine which infants need to have a workup for critical heart disease once they are identified by the screening test, and then a system to perform those evaluations with as little disruption to the life of young families as possible. We believe there are several problems with progressing extremely rapidly to instituting the screening test in all of the hospitals in New Mexico. Problems both with the selection of entrants to be tested and with the logistics of getting those secondary tests done. First, there is no current information about what oxygen levels should be used as a cutoff at altitude as high as those in which we're sitting today. As I often say to my wife, who's born in Milwaukee, every bit of New Mexico has an altitude greater than every bit of Wisconsin. Since oxygen levels are lower in all of us than they would be in Milwaukee or Washington, D.C., they are also lower in newborns here than they are in lower parts of the United States, a problem that we share with other Rocky Mountain states such as Colorado and Utah. New Mexico and those two states are currently working to determine what oxygen level should be used to identify high altitude infants who are at risk for critical heart disease. Good information should be available within the next year to answer this vital question. Secondly, facilities for further evaluating critical congenital heart disease are concentrated in Albuquerque, meaning that at this point, infants screened positive for CCHD would have to be separated from their mothers and transported by air to one of the big centers in Albuquerque. Work needs to be done to try to provide other, less intrusive means of getting this evaluation done quickly, so the babies like those we've heard about can be saved. Perhaps by using the very promising method of telemedicine that this chamber seems so good at promoting. Dr. Beth Goins, who is head of pediatric cardiology at Gwinnett Hospital, states that in the beginning of a program of testing newborns in just the way that everyone here believes important, there have been 56 positives out of 3,623 infants who've been screened, and only one of those infants has been shown to have critical congenital heart disease. On a statewide basis, that would mean that roughly 430 infants each year would need further evaluation. For some, that would be relatively easy if they're born at UNM Hospital or at Presbyterian Hospital. But those are the only places in the state where pediatric cardiologists are available. The rest of the state would be very much more difficult and very much more dangerous to put them in a plane and send them off to Albuquerque. At least until educational programs are developed for pediatricians and ultrasound technicians around the state, so that appropriate evaluation should be done closely at home. I have a personal interest in newborn screening. 16 years ago, my patient Brendan was born in a hospital in Albuquerque. He almost immediately got very sick after a very stormy course in which he repeatedly almost died. He was diagnosed with having a rare condition called methylmalonic acidemia. He would not have lost the first 8 of his 9 lives if he had been diagnosed by newborn screening, such as now would be the case. Methylmalonic acidemia is one of those conditions that is screened for that's listed in the list in Representative Espinosa's bill. He's a fine young high schooler now, but I feel very lucky. His mother feels especially lucky to have him with us. So we believe that added screening for critical congenital heart disease is very important. We don't think that this can be done all of a sudden, say on July 1st. Research needs to be done at high altitude, and educational and evaluational methods need to be set up first. We hope that Representative Espinosa and this committee will consider passing this bill and making it occur, but in a time frame that allows these important steps to be taken. Thank you very much.
You can keep it point and short answer.
Mr. Chairman, members of the committee, my name is Frank Warren. I'm a registered lobbyist for Blue Cross, Blue Cross and Blue Shield of New Mexico, one of the larger health plans in the state. And I'd just like you to know this is a mandate, but it's a mandate that the company supports because it's important that this type of testing be done, and it will save lives, and so we're very much in favor of it. And just take note, health plan supporting the mandate. Yes.
Mr. Chairman, members of the committee, my name is Natasha Ning. I'm a registered lobbyist for United Healthcare, and I just want to echo everything Chris said in this kind of support the bill.
Mr. Chairman, members of the committee, my name is Dick Mason of Health. And we stand in support of this legislation.
Anyone else? Anyone opposed? Member Ralph.
Thank you, Mr. Chairman. Nelson. The Health Science Center, are they doing any type of testing now?
Mr. Chairman, I must defer to what the Health Science Center is doing. That at this time.
Anybody here from the Health Science Center?
Mr. Chairman, Representative Mylan's children from Albuquerque have not testified on behalf of the Health Science Center. That's where I work.
Nobody here from the Health Science Center? Well, I think we need to understand why this is necessary and the extent of apparently the concern about cost. But this will apply to every area that's released, before they're released from the hospital, am I correct?
Yes, Representative. And may I see that, Representative? I think that, I don't know if you came in when you saw the testimony. This is a little apparatus, and there is all the hospitals, and that they are not against it. It's minimal. What is it? About $6. And they already have the machines. What this is the apparatus that we're looking at, and this is what they put on the baby. And at this point, we feel that it's extremely important because one child, if it was mine, and this little apparatus has $6, and we heard also testimony, Mr. Chairman and Representative Varela, that even this is a mandate, and I am one of those, and you've known me ever since I've been here, that I'm against any kind of mandate, and but this for saving babies and babies and what today, and this is all it is, and putting this on it. Thank you.
Chairman, this is your last committee. So you, get an idea of what, if any, costs and the type of work involved, or any alternative in terms of new invention, I guess, something we can do, have better than this. If we're able to have a health science center, and other hospitals in the area, be able to provide this kind of testing.
Thank you. Yes, we will look into that and get that information when it's on the floor and have it ready. Thank you.
Next, Representative Dr. McMillan.
Thank you, Chairman. Representative would address some things to Booths. Am I saying your name properly? What? I want to commend you for turning your loss into what might be someone's gain. Thank you for that. And we would enjoin you as well to be patient with this process. As has already been mentioned, we can't be only hasty of implementing how we're going to do this. Now, I will support this bill. If we're not careful and methodical about how this is introduced, we could create hazards. As the pediatrician has already mentioned, we don't know what represents an abnormal with respect to what we're trying to screen. We're going to need to know what that is. And we also need to formulate what we'll do in the case of an abnormality. Just finding the ones that might need further attention is not going to do the job. If we don't sort that out carefully, then the process of transfer could be hazardous. And so all of this is going to have to be sorted out carefully. Is anybody here from Health Department? We want to mention that we hope that the Health Department, if this bill passes, will be methodical and cautious in implementing this so that we do not create more hazards by doing it. This is a little more complex than a $6.
Mr. Chairman and Representative, you are correct. The Health to protect the children, you know, the babies. But they are in support, and we'd be working on with them, and I'm sure the mom, but they are aware of implementing, I guess, some regulations. And we heard testimony also, one understood that looking forward for the regulations from the department.
Thank you, Chairman and Representatives. Also, there are disparate needs in different parts of the state. And so the health department will need to give some careful consideration and deliberation about what an abnormal reading might mean in the far northwest corner of New Mexico as compared to somewhere in the county, and how we will handle that. Finding an abnormality and pitching a newborn into an airplane may not be the solution depending on where we are. So this is worthy legislation, and I just would say be patient with it. We need to sort through it and make sure we don't hurt anyone in the process of implementing this. And that's all I have.
Thank you. People only apply to hospitals and clinics.
I'm sorry.
This will only apply to baby born in the hospital, to health clinics.
In the hospitals, and at this point, we, from what I understand, Mr. Chairman, and Representative, is that already other hospitals, in fact, if I may defer, what you were telling me that other company?
There's 5 hospitals in the state of Mexico that I know that are doing it, and I spoke to a director of our, probably our largest hospital in New Mexico, and they've been doing it for 2 years. In those 2 years, they've been on one critical heart disease, and then at the point of discharge with perfectly healthy baby, they found through this O2-SAT measurement a baby that had sepsis or infection and pneumonia. And they were out the door and been perfectly healthy, and that screening not been done. We've been doing it at, we're in Roswell for about a year. We have not had any problems, but shortly before we started instituting it, and probably the reason why we did, is we had a perfectly healthy baby that had a strange murmur, which babies have murmurs. And we were really real blessed in that there happened to be a pediatric cardiologist at one of the doctor's offices. And they discharged the baby immediately over to the office, and when he found the O2-SAT readings, he immediately transported that baby. And that baby had a very serious critical heart disease. And we would have been able to pick it up at discharge, but we were just fortunate in that an hour later. And when I asked the mom, did he do any other tests? Did he do an echo? Did he do anything like that? She said no. He knew by the sound of the heart murmur and by the O2-SAT readings that there was a serious problem. That baby had surgery, is now about 15 months old, and is perfectly healthy.
Representative Thompson?
Thank you, Mr. Chair. Thank you, all of you. I'm an anti on this bill, and I think one thing we need to keep in mind is we can't let the perfect be the enemy of the good. I mean, this is a good bill. It's not perfect, but if we save one baby in the time that we're getting everything in order, I personally think it's worth it, and so I'm going to make a do-pass motion.
Motion, do pass. Second. And let me just say, Representative Espinosa, I think we heard this presentation in house.
Yes, sir, we did.
And I always remembered that, because I think we did verbiage as well. Thinking about my own grandkids and everybody else. And we need this apparently, and I support it as well. As Dr. McGill said, answers don't come overnight. Thank you. With that, with a proper motion, proper second, are there any objections? See none? Having none, we'll see the request recommendation of this meeting. Thank you very much. Thank you, Mr. Chairman. Representative Hill. 50.
traumatic brain injury or acquired would benefit and should be best served by having this fund. Thank you.
Thank you. Yes.
Good morning, Mr. Chair, members of the committee. My name is Guy Surdy. I'm with the Governor's Commission on Disability. And we stand in support of this bill. But I'd like to tell you on a personal note, my brother had a brain injury. And a fund like this that could address some immediate needs. So I see it as a great
Mr. Chair, members of the committee, my name is Natalie and I'm a resident of San Jose. I've been a survivor of traumatic brain injury for the last 30 years. I had to recalculate today, and it's 30 years and amazing to me. I was in a motor vehicle accident. The brain injury service fund helped me on 3 occasions with short-term crisis situations. The last time was 4 years ago, and I know some of you have seen me working around the legislature as a disability advocate, and my recovery would not have been possible without the multiple times that I received support from crisis assistance from the brain injury fund. I stand in support of the bill, and I would like to see people with acquired brain injuries be able to be included as part of the brain injury service fund to help all of us who have brain injuries move ahead in their lives as survivors and get back on their feet and become productive, contributing members of society. I've lived in New Mexico for 21 years, and I appreciate that this fund helped me over 19 of those years move ahead as an adjunct to therapies that I was receiving. So this was just short-term to help me in some small ways that the existing resources I have could not help me. I stand for any questions that you might have. Thank you.
Thank you, ma'am. Anyone else in favor? Yes.
I'm David Small. I'm a resident of Albuquerque. I'm vice chair of the Brain Injury Advisory Council, and I've also been running that brain injury support group in Albuquerque for 10+ years. My brain injury was caused by an accident. My heart stopped 20 years ago for some unknown reason. I lost 40 points initially, and now back to 25 points. Came back 25 of those points, I'm down 15. But my memory overnight is not kindergartners to remember what happened yesterday better than I can. But the point I want to make is that traumatic doesn't describe the injury itself. It describes how badly how the injury someone received occurred. If you get hit on the head, it's called traumatic. But if you have your memory wiped clean, as I did, it's called acquired and is therefore not eligible for services. I urge you to change the definitions. Thank you.
Anyone else in support? Yes.
Mr. Chair, members of the committee, my name is Brian Patterson. I had a traumatic brain injury 17 years ago this Halloween. I totally support this bill, and differences between traumatic and acquired are kind of silly. All brain injury is brain injury. We should definitely include that on the list. Thank you.
Anyone else? Any opposition? Seeing none, I bring. Yes, ma'am.
Mr. Chair, members of the committee, I'm Julie Weinberg. I'm the director of the Medicaid program at the Human Services Department. Can we have a category that is for anybody with concerns? Because we're not directly opposed to the change in the definition, but we want the committee to understand that we don't know how this would be. We would fund the additional individuals who would qualify for services under the brain injury fund, since we've estimated it's about $2 million in additional revenues to support those individuals, even with people moving to Medicaid. And it's just simply that we wanted the committee to know that, and that's all. It's a concern, not opposition. Thank you.
Thank you, Mr. Chairman. Mr. Chairman, this is the fund that was transferred from aging report. And what's the status of that fund now in terms of fund balance?
Mr. Chair, members of expanding. The fund is accumulating about $1.2 million a year. This is from $5 for moving traffic violations. And there has been a 3-year trend of those decreasing.
So, the health department, what's the status of the fund at this point in time?
Mr. Chair, members of the committee, we have enough, we have some surplus that we're going to apply to 2015, so we will be fully funded, which is about $1.8 million. However, in 2016, we will need somewhere between $600,000 and $700,000 just to make up to the current funding level, not including additional people who would qualify for services under the broadened definition of brain injury. Unfortunately, as Ms. Peterson explained, the revenues that support this program are on a downward trend.
So, Mr. Chairman, how does this relate to 18 departments to studies of Alzheimer's disease?
Mr. Chair and Representative Varela, Alzheimer's disease is not included in this current definition. So they aren't, folks with Alzheimer's don't receive services through the brain injury service.
That's what basically the extension does not apply to an injury that is induced by neurological disorder related to aging. And there's some elderly that experience a stroke, for instance. That's not covered under the brain injury fund.
Mr. Chair and Representative Morales, stroke would be considered under the brain injury service fund with this expanded definition.
Good.
Yes.
Okay, now in terms of the revenue sources, we have the traffic violation fee, but we also need to make sure that we are able to, at some point in time, supplement this fund if it needs to be done. This is something that we have quite a bit of concern about. It was not being well administered apparently at the aging department because of the other programs that they had. So I would like to see us come up with some kind of a proposal. How is this being affected by the Affordable Care Act?
Mr. Chair and Representative Morales, Centennial Care is, from what I understand, is going to affect this more during the present than the Affordable Care Act. With expanded Medicaid, about 50 to 65% of folks currently receiving services in the brain injury service fund will be found eligible. This is a short-term fund, so going into long-term services as a result of Centennial Care will open up some vacancies for folks. We also anticipate that for people with acquired brain injuries that could be eligible for the service. What this can do is help people get to those long-term services through expanded Medicaid. This fills the gap until people get what they need on a longer period of time. So although the Human Services Department feels that it will take an extra $2 million to support extra people, what we're hoping is that people are in this fund not for 1 and 2 and 3 years. They get services and they get directed into what they need for long-term services within 60 days, 90 days, maybe 120 days. But we're really looking at people going into the program and out. As Ms. Dean mentioned, maybe they have to come back into the program for a short time if they lose their insurance. But it's meant to just help them get to the next place.
So, Chairman, we have another committee. Maybe we need to explore the possibility of maintaining the efficiency of the fund. And we don't know when the Affordable Care Act or not to the point of being able to service the entire health environment. And something like the Health Policy Commission, which is a policy-making commission that gathers data and recommends to the policymakers what direction to take for healthcare. Perhaps we could explore creating that the commission that is in law right now, and it's not funded. So we don't want to consider restoring that Health Policy Commission or something like that. Thank you.
Good question.
It's only advised to, people who have no Medicaid or no other means of insurance or something like that.
Mr. Chair and Representative Salazar, this is intended for people who may have Medicaid and will help them get into Medicaid, for people who have, who are in between insurances. Some people with private insurance still may need some support getting into community or federal or state services, and this can support those people as well.
Mr. Chairman, do we have an idea of how many people we're talking about?
Mr. Chair and Representative Salazar, the Brain Injury Advisory Council funded a study probably 4 or 5 years ago through the Department of Health. And what we know is at that time, we have about 1,400 hospitalizations for traumatic brain injury, about 7,600 hospitalizations for acquired brain injury. What we know right now is the Brain Injury Service Fund supports about 400 people a year. Those are people with traumatic brain injuries. But that doesn't mean that 400 people are being served right now. Today, there are about 166 people. People have moved in and moved out. To this quarter, we're 3/4 through the year, about 265 people. So when we're looking at the amount of people out there with brain injuries who may need the service fund, it could be 400, 500. We don't know how many people per se we can actually fund now that we have expanded Medicaid for people to go to something else.
Good question.
Thank you, Chairman, Representative Trujillo, thank you. Just a couple of questions. The expanded definition, where did you come up with that? Has that been used? Other programs elsewhere? This is not, we're not applying any rule here?
Mr. Chair, Representative McMillan, thanks for asking that question. This definition actually duplicates the definition that we use in New Mexico for long-term services. What used to be MIVIA, which is now long-term services in the Medicaid system, this is the identical definition that we're currently using for that.
Chairman and Representative Trujillo, many of my questions have been answered by the other, many of these other questions. Can you give me a factor of how this will multiply the number of candidates for these services if this is passed?
Mr. Chair and Representative McMillan, Human Services Department estimates that there could be an extra 550 people. And if that is true, based on the statistics that we have, what I would hope is that this fund can get people in and then get them to where they need to go, so that right now we're already supporting over 400 within a year. We could add to that and support people, getting them where they need to go.
Chairman and Representative Trujillo agreed you'd like to do that. But I echo Representative Vello's concerns. Are you going to run out of money? There's no request for funding. And if we expand this too soon, and a lot of people are promised services that for which funding is not provided, have we not done more harm than good?
Mr. Chair and Representative McMillan, it's a good question. Human Services Department has contract obligations to a certain point. We're not going to overspend. I think within the next couple of years we'll have a better sense of the Affordable Care Act. We'll have a better sense of what centennial care will do to support people. In the meantime, wouldn't it be wonderful if we could support some folks with acquired brain injuries to get to where they need to go? So I don't think at this point that we're certainly not going to overspend because we have contractual obligations. We're okay for FY15. I think within the next year we'll have a much better sense of what our healthcare system looks like. For this year, if we can support 200 or 300 people with acquired brain injuries to make up the vacancy rate with those folks with traumatic brain injury leaving the fund, that would be incredible.
Thank you, Chairman. Representative, of course, it would be wonderful. Okay. When would you run out of money? That's what I'm asking. Do you have enough money in the fund now to expand these services the way you're suggesting that need to be expanded? Can you do this over the next year or two without an appropriation?
Mr. Chair and Representative McMillan, it is my understanding that we will be able to do that if this bill were passed as of July 1. About 50% to 60% of the folks in brain injury service right now. So 200 people will be going into long-term services. We will have service providers poised in the field, and they will be ready to assist 200, 300 people over the next year. What we also know is this is a really small program. There is not even a lot of public relations and marketing about this. So to get 200 or 300 people into this program, I think that we can do that this year and not break the bank. We'll meet contractual obligations and keep the 200 or 300 people with acquired brain injuries will be supported.
Thank you, Chairman.
Thank you.
Thank you, Mr. Chair. The definition as expanded that has been used in other places, Mr. Chairman, Representative, it makes total sense to me just because the end result will be the same kinds of cognitive difficulties. And from what I'm understanding, you have an advisory council that oversees the way that the brain injury service program is implemented. You have a group of clientele out here supporting the measure, some of which are covered under the traumatic definition, and they're willing to expand this to others because they see how useful it was for them. It seems that managing how the services are delivered and just being more inclusive of a larger group is something that everybody involved really supports and wants. I agree that the definition needs to be expanded. I mean, I run these calls all the time. I see them when these injuries occur. Technically, you could say that everything on this list is traumatic because it's sudden. But by our own narrow definition of it related to below to the head, now we've kind of left out again, maybe unintentionally. But it seems to me that you're right. We're poised on a possibility of being able to assist people get better health care. And I have a question that is part of the services of your group to help people navigate the health care system.
I want the committee to understand that we're not going to stress this on more because more people are going to move over to extended Medicaid. So I think this on the state.
Mr. Chairman, so my question of assistance, I haven't quite heard the answer that I wanted. I think you've mentioned in your testimony, but is part of your service assisting people navigating our healthcare system?
Mr. Chair and Representative King, yes. There are service coordinators in each region of the state that work with people with brain injury to navigate the system for health care, for housing, for medications, for therapies, all of that, yes.
Well, then, Mr. Chairman and Representative, it seems that you're not providing those services directly, but you're helping them find the resources that they need. And I have fairly normal mental capability, depending on whether I got any sleep last night. I have tremendous difficulty navigating our healthcare system, and I can only imagine the frustration and the stress that individuals with some cognitive problems have trying to sort their way through this. So I think this is a program that deserves our support. So I really want to extend that issue. Thank you for bringing this.
Chair and Representative Bell, it would not include something like Alzheimer's disease. It does
I'm
not.
talking about stroke.
A stroke it does.
Now, let me ask about that. We didn't mention anything that's covered by Medicare. Medicare covers to some extent. But I'm trying to understand why that Medicare reimbursement or contribution, would that apply for the brain injury fund also to be able to acquire funding from Medicare?
Mr. Chair and Representative Morel, interesting point. Medicare, at this point, the only funding source for the brain injury service fund are those $5 including private violations. I have some personal experience with an elderly mother who has fallen and is on Medicare, and she's received some services in her home very short term relating to that fall and the brain injury that she sustained. So Medicare does pay for some of that. And when we look at the demographics and ages of people that are currently receiving services through the fund, most of the people are under the age of 65. I think, if my memory serves correctly, there are about 20 people right now that are receiving brain injury service fund, who have traumatic brain injuries that are over the age of 65. So they, folks that are older are getting their needs met elsewhere as well.
So, we get inquiries about the Retiree Health Care Act, and there's a number of elderly people that are affected by stroke. They have recovery, limited in terms of the time in the hospital, but they can be sent to a nursing home. And they need to get some funding also to the Blue Cross or Blue Shield. And maybe we ought to get the Retiree Health Care to define what they cover under Medicare, to the collaborative that they have with the federal government as well as the insurance company, to determine to what extent a brain injury caused by stroke, to what extent that could be serviced through the Medicare program. Yes, through the Medicare program. And Human Services, you will only inquire into that also.
We do have a motion for new pass. Representative Butler. Properly second by Representative Thompson. Further discussion, comments? Any objections to the motion for new pass? Seeing none. House Bill 58 will see the new pass recommendation. Moving on. The lady who has the horses.
The Horse Racing Act makes performance-enhancing drugs illegal. Horsemen must sign a contract with the racetrack when they agree not to use these drugs. The contracts provide that the track may eject or exclude anyone who violates the drug penalty. However, some violators who are excluded or ejected from a track are filing lawsuits against the track, and this is creating a disincentive to the strict enforcement of the statutory drug policy. This bill allows tracks to exclude or eject the violators and provide civil immunity for the lawful exclusion. Mr. Chairman, this is a very necessary bill to take New Mexico out of the bottom of the rankings of the racehorse industry in the nation. And joining me today is Mr. Scott Scanlon.
Mr. Chairman, members of the committee, Scott Scanlon, registered lobbyist for Sunland Park Racetrack Casino. And we appreciate very much Representative bringing this bill forward. It's sort of a continuation of a couple of pieces of legislation that she and Senator Payton did last year for an effort to start cleaning up our racing industry and we focus on the backside of the force.
So, don't worry, when it comes over.
Support for the bill and we will incorporate it.
Okay, we will do the audience. Those in favor of House Bill 130 as amended?
Sounds good. Sounds good.
Right here. Very good. Anyone else in favor? Yes, ma'am.
Mr. Chairman, my name is Susan Bastillo, and as an owner and breeder in the state of New Mexico, I strongly support this bill.
Thank you. Thank you. Anyone else in favor? Any opposition? Seeing none. I have a question for you, their expert witness. Are the sewing horses faster than the rolling horses?
Mr. Chairman, it's yours.
Anyway, questions by the committee?
Mr. Chairman, thanks for bringing this bill forward. And the problem as I see it is that the district courts, despite finding from the Racing Commission that these horses were being drugged by certain trainers and split samples, and despite the fact that these trainers were companies for horses for performance-enhancing drugs, the district court was putting a stay on this one, so that either the stewards or the full Racing Commission would issue suspensions to some of these offenders, and some of the district court judges would put a stay on those suspensions. So as a result of that, these bad actors were getting into our racetracks and continuing to race and continuing to drug horses. So we can't do much with respect to what the district court judges do, but I think this bill strikes a very good balance in that it allows the track owners to eject these bad actors and keep them off there, out of their tracks. So another problem we've seen recently, Mr. Chairman, Representative, is that despite being found guilty of doping horses, some trainers were ejected by the tracks, and then they sued the tracks for ejecting them, even though they were busted repeatedly for doping horses. So that's why, in my mind, this liability provision is very important. The tracks, if they pursuant to the provisions of this bill, the Act, will be able to eject these bad actors from their track, not have to worry about getting sued, because they have ejected these. So, thank you, Representative Zell, Mr. Chairman, for bringing this bill. I think it's very much needed and will go a long, long way in cleaning up our racehorse racing industry.
And Mr. Chairman and Representative Gentry, I appreciate the statement that you just made. Our concern here is for the safety of the horses, the safety of the jocks, and the peace of mind of the betting public in the state of New Mexico. We have to get these bad actors out, and we need to make it safe. Thank you for that.
Any questions? Motion for you passed, resolution by another, second by Representative. Any objections to the motion on House Bill 100 as amended? See none?
declaration stuff, you got.
Thank you, Mr. Chairman.
And Mr. Johnson, we're, the best of luck.
Thank you very much.
Good job, Mark. Next. It's gonna be here in the.
Starting on page 1 and then go to my page 2. What we do in one department and include also we include some of the private sector entities and associations, law organizations, organizations, people. In essence, this bill is not changing any, is not transferring any land. We're essentially asking the second task force for 2 years. Just to hear testimony, get all of our information, make an informed decision as to whether we would want to move forward with the transfer down the road.
For the record, any comments from?
Good morning, Mr. Chairman. Blair Dunn. I'm the special lobbyist for Otero County and the lawyer here in New Mexico. I won't add to belabor things too much. Several concerns with my grandfather, and things like the severance fund or the severance tax and the deferment fund are certainly crucial and something that was a great thing for the state that you worked on. And I think doing the diligence to see whether or not there's a way we can grow that and make that a better deal, and bringing all of the stakeholders to the table is certainly something that's very warranted, and ultimately something that we should be doing as the next thing making the city better. So a task force of stakeholders is certainly the correct place to start.
Thank you. Okay. Those in favor? Let me start on my right this time. Who's in favor of this legislation? Go ahead. The lady up front again.
Mr. Chairman, members of the committee, my name is Carla Sontag. I'm with the New Mexico Business Coalition, and we stand in support of this legislation. You know, the lands in the east are mostly controlled by the states, and out west it's not. And we were the victim of that recently when the federal government decided to withhold part of our oil and gas royalties. The state got it back, but we shouldn't have that fight. This bill is just set up to study if we should take those lands back or not. For that as well, but in the meantime, getting the stakeholders together and studying this is a really good idea, and we hope they will support the legislation. Thank you.
Yes.
Mr. Chairman, members of the committee, my name is Pat Boone. I'm president-elect of New Mexico Cattle Growers. We feel that bringing together of all these multiple agencies to represent all of us stakeholders to study the feasibility of this transfer or acquisition of these public lands is a very good idea. The education of our children, of course, is of high priority to all of us, and if it is proved to be feasible, the acquisition of these lands will certainly add to the fund that educates our children. Therefore, New Mexico Cattle Growers stand in support of this motion.
Thanks.
strong support of this bill. We have members located throughout the entire state of New Mexico. We have land users who utilize permits and utilize land leases, and we would be greatly benefited by the opportunity to be a stakeholder in such a wonderful idea of a feasibility task force like this one. We feel that it is of great importance that stakeholders and land users, other than just government agencies, have the opportunity to speak on behalf of their proprietors. It's for these reasons that I echo what everyone else has already said and stand in strong support.
Next. Anyone else? Yes.
Mr. Chairman, committee, my name is Alfredo Ebola. I'm a former rancher from the Coahuila Valley. And I feel the federal government's got a pretty good track record of managing lots of lands that they do have and or do control and all. And I feel the state would do a much better job of that. And we all benefit from that. Thank you.
Anyone else on this side in favor? Okay. On this side, Mr. Senator.
Mr. Chairman, members of the committee, I want to qualify. We're not necessarily in support of the legislation, but we do want to look at the substitute. The substitute is an improvement over the previous legislation, so I just want to tell everybody, my clients, the fellows in Florida, Senator Clark, okay, when they don't have an official position, so we can do this more clearly, but the substitute does provide a lot of opportunity for the tribe to speak and act and participate equally on the task force, which is much different from the previous system. So this one, I'd like to clarify from here, neutral until we can analyze the substitute on the board.
Next. Way back there.
Good morning, Mr. Chairman and members of the committee. My name is Conroy Chino, and I represent the people of Acoma, the Hickory Apache Nation, and the Nespero tribe. We support the bill because on its face it seems to appear to be tribal friendly, particularly with the number of representatives from the tribes, all 22 or perhaps 23 at this point, who will be members of this committee or this task force, as well as having some authority in what gets transferred and what does not. But I also want to remind the committee that tribes have worked long and hard to establish agreements with the federal government regarding tribal lands, particularly with the BLM and with the Forest Service, in order to be able to gain access to federal lands and also to be able to protect sacred sites and cultural properties. So this is the reason why the tribes have a particular interest in the creation of this task force and to make sure that those lands and those agreements are protected. So we stand in support, Mr. Chairman.
Anyone else in favor? Those in opposition? Okay. Starting on right.
Mr. Chairman, members of the committee, excuse me. My name is Sunil Stewart. I'm the Deputy Land Commissioner. Mr. Chairman, we greatly appreciate Representative Harrell's efforts to consult with interested stakeholders. Unfortunately, we're unable to support this legislation as it's currently drafted. We have strong concerns about the transfer of all federal lands to the state. Commissioner Powell has put forward a proposal that is much more targeted at assessing whether the state can acquire some of only the BLM lands that BLM itself has identified for disposal as a mechanism of growing the lands that the state has to generate revenue for education. There are two areas that I just wanted to draw the committee's attention. Mr. Chairman, if you look at section 1, paragraph G, 2 through 3, and I'm not sure whether this refers to the committee substitute because we don't have a copy of that. I only have the original bill. But the study does contemplate the possible transfer of state lands out of state hands to land grants or tribes. And that would be a particular concern to the state land office where we were granted land by the federal government, put in trust to generate revenue for education. All of those lands under our state constitution and federal law are dedicated to a particular beneficiary, important public institution throughout the state. So if those lands, and it's unclear if and how many of these lands transferred out of the state hands to others, that would inhibit our ability to generate revenue for school kids and potentially put pressure on the general fund to make up that shortfall, leading to possible increases in taxes. The second area that I just wanted to bring to today's attention, Mr. Chairman, is that the land office is funded through the land maintenance fund. Those are revenues that we derive for our beneficiaries, public schools, universities, and hospitals throughout the state. We are constitutionally prohibited from using those monies for purposes that do not benefit the state trust. It's unclear under this proposal where the lands would go, and it's unclear whether a study of this nature would fall within the purview of advancing state trust lands, and thus whether this would be a permissible use of the money. We anticipate that although there's no money that's allocated under this legislation, this study would cost hundreds of thousands of dollars, and the land office is charged with picking up that tab to a large extent and providing resources and staffing. And we don't have that capacity without diverting our important other areas. So for those reasons, Mr. Chairman, I'm available for questions, but I appreciate the committee's attention. Thank you.
Thank you. Anyone else in opposition? Yes, sir. Anyone at the gentleman there?
Mr. Chairman, there are members of the committee. My name is Garrett Dunn-Clausen. I'm the Executive Director of the Mexico Wildlife Federation. We appreciate Representative Harrell's attempt to be inclusive on this. We're in opposition for several reasons. I just want to take a step back and remind everybody that the Enabling Act of New Mexico of 1910 and the Constitution of the State of New Mexico of 1911 both state very clearly the people of New Mexico do agree and declare that they forever disclaim all right and title to the unappropriated and ungranted public lands lying within the boundaries thereof. So first of all, it's unconstitutional. I don't really understand why we're going through all this until we can figure out how the feds would want to change this. And Utah's going to spend probably about $3 million to try and muddle through this. Why not let Utah try and figure this out? I'm not exactly sure why we in New Mexico need to spend valuable time and money doing this. I also just want to remind everybody in the committee that New Mexico generates $450 million in tax revenue and $6.1 billion in consumer spending each year, while employing 68,000 people, and that's all related to using public lands just in recreation. I also want to remind the committee that New Mexico sports is spending $579 million and $250 million in salaries and wages and $58 million in tax, state and local taxes. This is all related to using federal land. This is a resource that we, the sportsmen, really cherish, and it also has a cultural value. Hunting, fishing are not just sport in Mexico, it is a cultural positional value. So,
Thank you. Gentleman next.
Mr. Chairman, members of the committee, John Crenshaw, I'm president of the New Mexico Wildlife Federation. We opposed this bill in several forms last year, and we this year. We do support the approach in Senate Bill 1 that the chairman just alluded to. It is a methodical approach that has an appropriation to go with it if it's passed, to identify federal lands that could be a benefit to the state and leave those alone, which will not be. It also recognizes that federal law forbids giving away federal property. It has to be either sold or traded for like value. And for those reasons, we would support this. I think that Mr. Vandenhouse has given you a pretty good idea why the committee is agreed to meeting. And we do urge that you do not pass. Thank you very much.
Yes, sir.
My name is Homer Mitchell. I'm the Public Lands Director for Trout Community in New Mexico, and also a partial owner of these lands in question as a public citizen. On this issue in general, I think it's important to acknowledge that the
I'm Executive Director of the Conservation Voters of New Mexico, representing 3,500 people across the state. We strongly oppose the bill for several reasons. One, we're very worried about the composition of the task force. 3 members would be directly appointed by the governor, and 3 to 4 indirectly. And we worry about fair representation of the public, the federal government, and even land grant people. Also, we feel it is a really bad use of our resources because the state has no authority or ability to make these transfers. Thank you.
Well, Mr. Chairman, I'm Patrick Davis, Executive Director of Progress Now. In addition to the good reasons already presented by our friends, we also asked the committee to consider that this is an ALEC bill, and we ask that even though some of the ALEC members of the committee may be well aware, we encourage you to ask the bill sponsors about the ALEC origins of the bill and the corporations and other entities that contributed to its creation. The bill is modeled on ALEC model legislation, the Disposal and Taxation of Public Lands Act, and we encourage you to oppose it for that reason in addition to the others.
Thank you. Anyone else? Yes, sir.
Thank you very much, Mr. Chairman, members of the committee. My name is Dan Lorimer. I represent the Rio Grande chapter of the Sierra Club and its 8,000 members in New Mexico and West Texas. We stand in opposition to this bill for many of the reasons already well expressed. But I would like to bring up the fact to this committee that these lands are currently owned by all Americans. We're among them. These aren't our lands. So we stand in opposition to this bill. Thank you.
Anyone else in opposition? I have Representative Varela first.
Thank you, Chairman. Chairman, who at the federal level would be negotiating a ALM? What federal agency would be negotiating on transfer of these land from the federal to the state?
Mr. Chair, I'm going to
Mr. Chairman, Representative Varela, ultimately, this is going to come down to Congress. They're the ones who are currently deciding whether we're looking at older Iowa land. What this does is it starts a process where we engage in discussion with the rest of the western states and eventually
it's a $458 million in tax revenue and $6.1 billion in consumer spending, and employing 68,000 people. That's the recreation industry.
Chairman, now what happens to the dollars once, if the lands are transferred to New Mexico? At what point in time will we recover the dollars that will not be paid anymore by the federal government?
Well, I mean, the problem is once the land gets transferred theoretically to the state, the land office in the past has sold its inventory, and so suddenly that land is privatized and you have less access to land. And so with less access to that land, theoretically, there's less opportunity for the public to recreate on that land because it's private land. So it's I mean, if you start to privatize land, you reduce the amount of public opportunity to recreate on it.
We don't discuss, Mr. Chair, there is no conversation we can take with privatizing these lands. In fact, we don't want to privatize any of these lands. We would like to see if, and it's a huge if, we were to transfer these lands at some point in the future, we would transfer them status quo. We have over 100 years of use on these lands when it relates to grazing, hunting, fishing. There's no way we want to privatize these lands. So that I don't know where that information is coming from, because that's not even mentioned in this, and that's not the plan that the state wants to.
Maybe they was trying to say like the Mesa and Sol became sort of economic development incentive for Albuquerque, and but that was done through the state land office also, and I don't, you might need that kind of, not necessarily private, but it's utilizing for other beneficial uses, and make it up to the dealing with the case. Now, so everybody from the land office, and you're opposed to this particular
Mr. Chairman, representative from the Deputy Land Commissioner, and we are opposed.
You are opposed to this, and in the bill, where is the appropriation language and substitute?
There is not, Mr. Chair. We set it up similar to how the Building Maintenance Commission or the Jobs Council is set up. We just appointed, in this substitute, there are actually 3 agencies appointed. In the original bill, House 1 and 2, there were only 2 agencies named, which was the State Land Office and the Office of Environment, sorry. It is current committee, substitute is 3, the Land Office, Environmental, and also, there's 3 of them. Okay, Legislative Council, so the State Land Office was the original, and now we have Minerals and Energy, State Land Office, and Legislative Council.
So you're talking about yellow fund, we're talking about land maintenance, am I correct?
General fund, yes, sir.
Land maintenance, once removed, the dollar reverts to the general fund anyway, so that's already the funding. I already mentioned the national organization that's involved in that, so. ALEC?
Yes.
Yeah, why don't you stand up there? Yes, Mr. Chairman. This bill is a model legislation, it's not a model legislation that's promoted by ALEC, the American Legislative Change Council. So this is a committee, maybe you're all aware. But it's essentially, it's a, purports to be a nonprofit that connects corporations with state legislatures and works to create law
this bill, as we're looking at today, is what we have actually not an out bill.
Mr. Chairman, some of the folks that have not seen the substitute bill are concerned about the makeup. And I don't know how familiar, there was a lady back there that was addressing the makeup of the group here, and I don't know whether she was speaking from the original bill or the substitute bill, because the stuff seems quite a bit in terms of the makeup of this organization. I'm wondering, have they had a chance to determine, to take a look at the substitute bill, or you think that they can refer to it rather than to the original bill?
Mr. Chair, knowing how that, I think we just made a change this morning because we did have a dialogue with some of the representatives of the tribes and federal. And so what we've done is by changing the makeup of the community, now we can see that there's 23 seats at the table for Native Americans and tribes and 16 for non-Native American. And because we understand how important the land issues are for the Native Americans, we wanted to work just this morning with some members of the audience to try to make sure that we can incorporate their concerns. So we brought back this exact big substitute that we would have had before this committee last year.
Mr. Conrad, Rebecca, are you in support of this piece of legislation, the substitute bill? You quite understand.
Yes, I am, Mr. Chairman, and Representative Varela.
You are in support of the substitute bill?
We're in support of the substitute bill. Representative Harrell has communicated the changes from the original bill, HB 102, and shared a copy of the substitute bill with me this morning. So I've taken a look at it, and I discussed it with some of my clients, and they feel, as I mentioned earlier, that this is a tribal-friendly bill, largely because their reservations are surrounded, for the most part, by federal lands, and I have very deep concern about the impact that any transfer of federal lands will have on their agreements and access to federal lands.
So you say it's a tribal-friendly bill. Is it a people-friendly bill?
It's a tribal-friendly bill.
We're gonna have to find a care for the world. We can't have any Pakistan. Motion to table. Thank you.
I don't think it's fair to try to take tabling or do that without them reviewing this and maybe roll it over to the next meeting on Thursday, Chairman. Maybe at that time we can have a general public comment on the substitute bill. Give them the opportunity to take a look. That's the reason I'm also.
Yeah, I mean, I think the committee just this morning as well. I'm sure there is any minutes or something. There's a couple motions. I think we will call roll on this motion for temporary.
Representative Maldonado?
No.
Representative Fajardo? Representative Gentry? Representative Morel? Representative King?
Yes.
Representative Martinez?
Yes.
Representative McMillan?
No.
Representative Thompson? Representative Varela? Representative Salazar?
Yes.
And Mr. Chair.
Yes. So voted 6 in affirmative, 5 in negative, and 10 against. We are excused next to the committee, and we still have a couple more bills. Bill friendly.
It is friendly in my eyes. Chair?
With that, we will recess to the Thursday morning.
Okay, thank you, Mr. Chair. Yeah, so be the first one on Thursday. Yes, yeah. Gracias,
All right. Hi, Cindy. Nice to see you too.